When it comes to medications, there's a cost to doing business. Very often, the drugs don't work. And in this video, I'm going to explain why. Hi, I'm Rodger Duckworth, and for the last 30 years, I've been helping people on the edge of despair from their chronic health conditions and illnesses. And not only helping them manage, but to overcome and heal from those conditions. Medications are great. They have a place. They've saved my life, along with surgery. I'm not knocking these things. I am not some no medication advocate. That's not what I'm about. But I am a balanced practitioner. And I've been in practice long enough to see side effects. I mean, the Hippocratic Oath, number one, do no harm, but goodness me, medications create a lot of harm so often. It's become a default. It's become a default in the medical world to use medications as a way of managing things. Drugs, surgery, and that's it. There is not a drug out there that doesn't have a side effect. Yeah. And so what I see all too often is somebody gets put on a drug for something when there may have been another more healthy approach available. And they get put on that drug and then they get a side effect, and then they're going back to the doctor, and very often the doctor then doesn't seem to ever consider the idea that they might need to take them off that medication because that's creating the side effect. Because I think the thinking is, well, I can't do that because then how am I going to manage that? So that's not an option to me. So now I need to give them another drug that manages the side effects of that drug. And I kid you not, I will see long lists. People will come with printouts of more than one side of a document when they're elderly with a long list of medications, which probably have come, a good chunk of them, maybe keeping them alive, but probably a good chunk of them are actually there to compensate for the illness created by the other medication. I remember a long time ago looking that 1/3 of all hospital admissions are due to what is called iatrogenic illness. Iatrogenic illness is illness caused by medical intervention. Yeah? And that's a large number of people. Now, I'm not saying that we can't avoid all that, because if you didn't give them that medication, they'd probably be dead. This isn't saying that that's all bad. But I do think that we could really revise how we operate to reduce that number significantly if we were more intelligent. Let me give you an example. I saw somebody who was put onto antidepressant medication. They were put on it for probably too long, in fact, and there's a lot of publicity at the moment about the negative consequences of coming off that medication too fast or being on it for too long. So they were put on it for a couple of years and then began to notice that they had got low energy and they were fatigued a lot. They went back to their doctor, and the doctor did some blood tests and said, well, you've got low iron. Ran some tests, which was good, to go, well, why might that be the case? And they went, well, okay, that's normal. Didn't, by the way, question what their diet was like or even consider the fact that they were on this antidepressant medication. And then, well, we'll give you iron tablets. And then, of course, you go down the line, and then that iron tablet starts to then have other consequences on the bowels. And so it goes on and on. At no point did they consider that actually, if they knew that one of the primary side effects of that antidepressant medication was low iron. Oh, but I can't take them off that. Why? Because I can't manage that antidepressant. Well, you could. What about good therapy? What about good interventions? So I think that it's about a suite of interventions. Yeah, and knowing when are drugs really necessary, and really being aware that if we're going to put somebody on it, know what the side effects are, know those side effects as clinicians and as therapists, and be able to say, okay, that's not working, we've got to change that if we possibly can. Or is there another way? Only use drugs if you have to, as a bit of a last resort, instead of that's my primary function. I would just appeal to anybody watching this, if they're clinicians, to be interested in looking at their own clinical practice to see whether maybe there are other ways, or getting to know practitioners who work in a mind-body way and in an holistic way and in an integrative health way, whatever you want to call it, to be able to support them as clinicians in maybe reducing some of the medication used.